Bruh. Welcome back to SARPE surgery update video. Alright, great. Sorry it took so long to come up with another video, because I did mention like on my previous video that I was gonna make a video like on that like region of time following my orthodontic appointment. But the only thing that happened in the appointment was that they were like, oh, you're doing a great job, everything looks to be going well, just continue expanding and okay. And I was like, well, that's great content for my next video, isn't it? But anyway, we are currently almost 3 months post-operation. So let's address the gap first and foremost. So as you can see, compared to the last video, the gap has actually gone a little bit smaller. Reason being is that this tooth here is actually kind of like, it kind of stopped expanding after a while and started to go back into the middle. And what that has happened or has caused is this here. So I'm getting a gap like kind of like there, which is great because now I got 2 gaps. On this side, there's also the same thing's happening. So I got 3 gaps basically. So I'm like the gap master at the moment, to be honest. But it's not been a problem. So a couple of weeks ago, I went to my orthodontist and he said that you are done with your expanding. You've reached like the point where it's perfect, where your upper jaw is lining up with your bottom jaw. I should normally talk. Your upper jaw is lining with your bottom jaw. So that's essentially what it's like now. Now, in terms of the underbite, before this tooth was clashing on my bottom teeth, currently this is what's happening. So my underbite is now a overbite, but it's not a massive overbite. So if you have a look, it's sort of like just nice. This tooth here completely goes over my bottom teeth. However, what has happened is that my orthodontist said that this tooth here is kind of clashing, so it kind of does rub a little bit. And what's gonna happen is, because it rubs, it's gonna wear down the enamel, kind of like wear and tear, and that's not gonna be good for my teeth. So what they did was they filled my one tooth here with resin. I think that's what they said. What that's doing is that it's preventing my bite from actually like going down fully. So that right there. So that's my gap. So that's my current struggle. My current struggle is that I can't close my bite essentially, because that resin there is blocking the teeth from going further down, because they just don't want it to kind of like rub and wear down my teeth. So that's that. That's my bite situation. Let me just get my notes, cause great. My expander has expanded and it's at the right point. It's still gonna be in there. I've got a cashew nut stuck in there as well. I'm gonna deal with that later, but that's there in my mouth. It's gonna remain there because the jaw does tend to fight back. So I'm getting like I'm not getting too much tension, but I can kind of feel like, you know, my jaw is kind of like wanting to close, but then my expander is like nah. So that's that. It's gonna be in there for another 2 months before I get my braces. Speaking of that, braces, yeah. So braces will be happening in exactly 2 months from now. The reason that it wasn't done like currently is because my expansion took longer than expected because I had quite a narrow jaw, and in order to solve the underbite, I needed to expand it. I need to like overcompensate my expansion. And what that's gonna do is, because I'm not doing surgery to fix my jaw, because the expansion is gonna correct my underbite, the expansion was necessary to kind of like go even more. So now that I've reached a point where I don't need to expand anymore, I just have to wait now, let it kind of like sit in position for a bit, and in 2 months I'll get the braces on, and I'm only gonna get the top braces apparently, just to sort of like align that before putting the bottom one. Although that's a question I need to ask my orthodontist, which I forgot to ask the other day. Hold on. Is that, do I still need a bottom braces? Maybe to kind of like put the rubber bands, but like looking at my arch, it's looking pretty good, so we'll see how we go. So currently, because it's 3 months after, I can do anything I want. The only thing I still can't do is eat things like steak, and mainly not because of the healing process, but because of my bite. Because right now the only point of contact is that resin part. Here, I'm just massaging the steak, to be honest. I can't really like chew it, and if I chew it on the resin, it's just not really a comfortable feeling. So I still don't want to do nuts, but I can do anything else essentially. I can drink alcohol as much as I want. I can exercise as much as I want. So going back to the gym was exciting. Going for runs. Ooh. I still haven't had my Zinger burger though, but I'm saving that for like a time when I can really like sink every one of my teeth in and just like that's that. In terms of struggles, like physical struggles, besides that last day in the last video that I mentioned where it was like killing me, it hasn't been like absolutely crazy. My front teeth are still a little bit like shaky. My speech is not too bad. It can be better, but I mean, it's still annoying to have the expander in the mouth. Like sometimes it does rub on my tongue and it gives me like a small cut here and there, which is annoying. But I'm kind of like living, like just kind of like it's grown into me almost. So my smile, it's much wider, because I expanded myself. But what I mean by that is that because I used to have a narrow arch and my canines, you see here, I guess my lip structure has changed, so when I smile now it's kind of like really wow, like that. I'm not sure how it's going to look like with the braces, but according to the doctor they said that it's going to be a positive outcome, which is always a plus. And when it comes to like dealing with some of the smaller struggles, some tips that I can give is always gargle your mouth after like food. That really helps, especially things that get stuck in there. Like I've got a cashew nut in there right now, which is killing me, but after a quick gargle, it'll sort itself. It's really annoying when you get like spinach kind of like intertwined in there. That's a big horrible one. My girlfriend actually got me a water floss or an air floss recently, and that's been working like amazing, because things get stuck kind of like in between the wires and your teeth, and there's no way to get it out unless you use a toothpick to scrape it. But the water floss just like blasts it all out, so that's always good. 100% agree. Get a air floss, but apparently an air floss is much more useful when you have braces on, so that's another plus. And as far as like how I'm feeling personally, the results so far, I mean, I'm liking it. I can kind of see like my smile change, which is good. It's a bit awkward to smile with my mouth closed, you know, it's a bit weird. It's not like before. So I tend to smile with my teeth like that now, even with the gap, just because I'm working it, you know. I'm just like being full vogue, because you know, as models, it always has like. Anyway, so that's that. I will make another video soon, and I'm actually gonna keep my promise this time and make one. I'm just gonna figure out what it is before I get my braces, because another 2 months gap isn't gonna be like, it's gonna be quite long. So if I do get like heaps of questions on the comments, I will compile them and make another video to answer those questions. But so far I'm handling it pretty well, so that's not gonna be a problem. And yeah, let's have another one of those close-ups to kind of like see how the teeth are going, and then I will sign off. Great. Alright, signing off, and I'll catch you when I catch you.